Good morning, everyone. It's 10 o'clock here, so we will get started, and then anyone else who joins a little bit later can come in when they're ready. So today we're going to be talking about caring for vulnerable populations in a time of crisis. So we're continuing this series that we've been doing for the last 2.5 weeks or so. But today we're going to be talking about overdose response and how COVID-19 has played a part in how that might look for staff and organizations and for individuals in the community. So my name is Haley Moore. I'm a registered nurse here in Calgary, and I'm the co-founder of Westside Harm Reduction. So if you haven't been on any of our webinars in the past couple of weeks, my background is harm reduction. So I've been working in harm reduction for the past 10 years or so, mostly with vulnerable populations in sexual health and individuals who use substances. But we will get started here. I'm just going to go over a few housekeeping items before we start. So one of the first ones is Westside has collaborated with Street Cred and the Calgary Foundation. So there's funding through this initiative through the grant from the Boys and Girls Club of Calgary. And that's the reason why we can do these presentations on this platform surrounding COVID-19. So we just want to give a shout out and a huge thank you to Street Cred and the Calgary Foundation for providing that funding for us. All the presentation and promotional materials that we're presenting today were created by Westside Harm Reduction. And then the second thing I want to talk about is I always like to do an acknowledgement of the First Nations. So I would like to begin by acknowledging that the land upon which we gather today is Indigenous land. We also recognize that the traditional Blackfoot name of this place, where the Bow River meets the Elbow River, is Mohkinstsis, which we now call the city of Calgary. We would like to acknowledge that we are on traditional land of the Blackfoot Confederacy, Siksika, Kainai, and Piikani, as well as Treaty 7 territory, which includes Tsuut'ina and Stoney Nakoda, which is comprised of the three bands of Chiniki, Bearspaw, and Wesley. Calgary is also home to the Métis people of Region 3. And then the last thing I like to touch on before doing any presentation is just acknowledging that this is a safe space. And although this is a somewhat new platform for a lot of people, I'm sure we're all getting somewhat used to Zoom and virtual check-ins like this. This is still a safe space, even though it is a different platform. So respecting that, there is a lot of fears right now, and there's a lot of fear of the unknown, especially with overdose response. So just respecting everybody's fears and respecting that any question is okay. So we're going to be talking a lot about overdose response, but also, even though this is a little bit of a different platform, overdose response can trigger different things for different people depending on where they work, their past experiences, everything like that. So acknowledging that if you do need to step aside when we're talking about overdose response, that is okay. Feel free, shoot me a message on chat, shoot me an email at info@westsideharmreduction.com, and we can make sure to debrief it after the webinar is done. Even though we are on an online platform, I want to make sure that everyone is still keeping their mental health good as we talk about overdose response and understanding the effects that can come with that. So what we're going to talk about today, we are going to go over a few COVID-19 updates. So anything that's changed from our first really long presentation that we did about 2.5 weeks ago, and then anything that's kind of come up in the last 24, 48 hours, that's a little bit different. We're going to go over drug trends and harm reduction tips. And then we're going to get into overdose response and what that looks like, the PPE that's required for that. And we're going to talk in a few different scenarios. So with overdose response, we're going to look at what an overdose response looks like if EMS is not present, if there's no oxygen or CPR indicated. We're going to talk about what an overdose response will look like when EMS is present, if they're using oxygen, if they're using CPR. And then we are going to talk a bit about what an overdose response might look like for our clients. So when they're on the street and they are responding to an overdose, what are some tips and tricks that we can provide our clients so that they are also keeping safe when they're responding? As we all know, they respond to more overdoses generally than we do. So it is really important to include that aspect in there as well. And then we're going to do kind of a question answer segment. So the webinar portion of this will be about 30 minutes long, and then we'll get into questions and answers. The questions can come from anything that we've talked about previously, this presentation, or anything that's kind of come up in your workplace that you're wanting any kind of clarification on, or even just to have a discussion about. We've had some really great discussions just with the panel that of people that have been on. So just acknowledging that this is a community space, so we're all here to learn off of each other. So COVID 101, again, this infection, it hasn't changed. So it's still a large family of viruses found mostly in animals. It can range from kind of common cold to more severe diseases such as severe acute respiratory syndrome, or SARS, or the Middle East respiratory syndrome. So that's information that everyone knows. It really hasn't changed at all. So one thing that has changed is the amount of cases that we are seeing. So up until kind of yesterday at 2 p.m. in Alberta, we were just over 4,500 cases. Here in Alberta, 69% being in the Calgary zone. I myself am in the Calgary zone. I'm not 100% sure how many people on this webinar are from Calgary or Calgary surrounding area, but the majority of cases are falling within that Calgary zone. 195 people have been hospitalized, 50 have been in the ICU, and unfortunately we have had 75 deaths. And in Canada, we're looking at numbers that are just over 47,000 people, with just over 2,500 deaths. And then one of the great things that we're finding with Alberta right now is the amount of people we are testing. So we have been kind of highest rate in the world, or kind of in that kind of top 5 for the past, like month, 3 weeks ish. And we are still in that range. So we have tested over 135,000 people here in Alberta, which is very remarkable. And with any infection, the more testing that we're doing, the more cases we are going to get from that. So the amount of cases that we're seeing are a representation of how many people we are testing. So that's something to always keep in mind as well. And some of the updates that I'm going to go through is some of the language has changed just in regards to how long it might take for symptoms to appear with COVID-19. So we used to say that kind of 2 to 14 days. Kind of specialists are just saying that 14 days now. So the 14 days is the longest known incubation period for this disease. Other evidence has indicated recently that there is that risk for either pre-symptomatic or asymptomatic transmission. So pre-symptomatic transmission is just that individual hasn't yet developed symptoms. And asymptomatic transmission is that individual actually never developed symptoms. So up until a week or so ago, we were really just classifying individuals who hadn't developed symptoms yet as asymptomatic, and we've broken it down into kind of those 2 different categories. So that pre-symptomatic and asymptomatic transmission as well. Another thing that has changed is just testing. So how we're testing individuals. We've gone through kind of a numerous amount of change with how we're testing. We started off with just the nasopharyngeal swab, and then there is still a worldwide kind of shortage of these NP swabs, so we moved to the nostril swab. And something that they were finding with the nostril swab is there wasn't a lot of consistency with the technique for the nasal or the nostril swab. So they weren't sure kind of the effectiveness or the efficacy that was coming from that nostril swab because of the different collection techniques. And just up until kind of the last week or so, we've switched to as well doing a throat swab. So that's kind of a deep throat swab, so going all the way back to the tonsils. And they're finding that throat swab is just as effective as the NP swab. And we still now have quite a few of those tests in Alberta. So if you're needing to go get tested and they're doing a throat swab, don't be alarmed. They've broadened their spectrum for the types of tests that they are using. And then testing criteria has changed a little bit too. So this has adapted based on the trends we're seeing with COVID-19, but now they are testing anyone who has a fever, a cough, a sore throat, shortness of breath, or a runny nose. And since I'm assuming most of us are frontline on this webinar, they have within Alberta updated the self-assessment, so that they do have one specifically for healthcare, shelter workers, law enforcement, and first responders. So there is kind of 2. If you go to take a self-assessment, there's 2 different links. So there's one just for kind of general population, and then there is one for anyone working frontline right now. So healthcare, shelter, employees, first responders, all that good stuff. So make sure if you are working Frontline, you're clicking on that assessment as well, and it just goes through a few different questions than the general population screen. So that is what is new in within COVID-19. So we're going to start talking a little bit about drug trends with COVID-19. So there have been some things especially within Calgary, that have changed within the drug market with COVID-19. So methamphetamines and cocaine have drastically increased in price. So they are quite expensive right now, and they're not super readily available. So just something to keep in mind with clients who are using amphetamines, that you might notice like a potential decrease in mood just because their dopamine levels and serotonin levels will be substantially lower than they are used to. We are seeing a fair amount of carfentanil or carfentanil-like substances right now. Fentanyl right now has a substantial amount of benzodiazepines in them. So that is a sedative. So we're going to talk a bit about why that's important when we talk about overdose response, just to keep in mind that there is a lot of benzos going around within the fentanyl. Prescribed stimulants are a little bit in higher demand right now on the streets, just because methamphetamine and cocaine are substantially more expensive. And I did want to touch on Narcan just a little bit here, because there's been a lot of worry, I find, with different provinces and different communities, that they're worried that there could potentially be a Narcan shortage with COVID-19. And to this date, there is no indication that we are going to have a Narcan shortage. So that's just something to keep in mind, that we are still getting Narcan in. We're still not concerned that we aren't going to have enough Narcan to give to our clients, or for us to actively respond to overdoses. So that's just something to keep in mind, and maybe to decrease a little bit of worry and fear with that. So some harm reduction tips that we can talk about with our clients or with other staff members, just to make sure we're keeping our clients as safe as we possibly can during this pandemic. So one thing, super important for everyone, but making sure you're cleaning your hands before you're prepping any kind of substances. So clean your hands for at least 20 seconds with soap and water. If you don't have access to soap and water, using some kind of alcohol-based hand sanitizer. But again, only using that hand sanitizer if your hands are not visibly soiled. So if you can see dirt and whatnot on your hands, make sure, or do your best to try to get your clients to give them a good scrub with soap and water, just because alcohol-based hand sanitizer won't work properly in the presence of dirt or molecules that you can visibly see. Do your best to work with clients to minimize the need for them to share supplies. So this doesn't just include like rigs or needles. This includes stems, meth pipes, straws, as well as any injecting supplies. So if you're talking to clients and they're saying, no, I absolutely have to share like my stem or my meth pipe, like we just don't have enough to go around, strongly convince them or urge them, encourage them to make sure they're using a different mouthpiece. So whether that's a hose that they can like interchange with who's using it, but also different organizations within Calgary. So SafeWorks, their Connect team, their outreach team are providing stems and meth pipes, one per day. So encourage clients to access safe supplies there as well. So prepping your own drugs. So this is really important. So do your best not to let other people handle other drugs. So you want to make sure clients are prepping their own drugs. They've washed their hands. If they absolutely can't prep their own drugs, encourage them to stay in the room with the person who is prepping their drugs, which is just good practice in general, but also to make sure that they're using clean supplies. They've washed their hands as well. The surfaces are clean, that kind of thing, just to minimize that risk of infection. So get extra harm reduction supplies and naloxone. So there's lots of programs within Calgary and Alberta that do give out free supplies. So SafeWorks, you can go to a lot of emergency rooms or urgent cares to get all the supplies you need. So keep them on hand, have some extras, make sure you have extra naloxone as well. And then some things that people might not seem as common is encourage clients to avoid putting drug baggies in their mouth, anus, or vagina, just because to decrease that risk of transmission. We're not 100% sure what's going to be on that bag, but if clients have to carry their substances that way, make sure they're cleaning the bag or wrap thoroughly with like an alcohol-based hand sanitizer, alcohol swabs, something like that prior to inserting it and after taking it out. And then making sure if you're putting that baggie in your mouth, if you can use like a mouthwash before and after, that's beneficial as well. But encouraging them to like hold on to their drugs in a different method right now, just to reduce that risk of transmission to them. Again, working with methadone, Suboxone, OAT prescribers. Currently right now in Alberta, as of April 1st, there is a 120-day essentially free supply for kind of Suboxone and methadone for individuals who don't necessarily have coverage. So working with prescribers on that if they are having a hard time locating substances or not wanting to be out and about, to reduce kind of interactions with other people and reducing their risk of overdose and also withdrawal. There are kind of those methadone and Suboxone routes that individuals can go. And then as well, like preparing for that unplanned withdrawal. So our clients might potentially lose access to like their drug of choice in this outbreak. So we are seeing that happen with methamphetamines and cocaine, just with the price and just the lack of substance that there is, because kind of with that supply and demand aspect. So they might have to consider other drugs or medications that could help with that withdrawal. For opioid dependence, again, working with your local provider, if you can, with Suboxone or methadone. So also having a backup plan if your dealer potentially gets sick and has to isolate. So just talking to our clients and developing a plan with them so that they can either plan for an unplanned withdrawal or take some steps so that doesn't necessarily happen. And then responding to an overdose as safely as you can. So we're going to go through that within the client perspective as well, but using gloves, using the face shield that's in the Narcan kit. But again, we'll get into that in depth a little bit later on. And then kind of the last couple tips here. So if you are in an area where there is an SCS or a supervised consumption site or an OPS, so an overdose prevention site, encourage clients to use those sites just because, you know, things are constantly being wiped down in those sites. They are very clean because they are taking those precautions, but also they can respond to that overdose with oxygen and other aspects that we are generally not doing in the shelter setting. Encourage your clients to do a test shot right now. So like I said, there is a lot of very strong carfentanil-like substances out on the streets right now. So encouraging clients to do that test shot. Try to avoid mixing drugs as well. And then if your clients are not wanting to go to an SCS or an OPS, encourage them to use the buddy system and try to convince them to stay that 2 meters apart from their buddy. Just that they are with someone in case they overdose, that they're not within a huge group and can still practice that physical distancing from others. So those are just some harm reduction tips that we can talk about with our clients to keep them as safe as possible, just in general, but also with COVID-19. So what does an overdose response, what does an overdose look like? So we're specifically talking about an opioid overdose here. So what it is going to look like, mostly we're looking at that breathing aspect, so that respiratory rate. So slower erratic breathing, that bluing of the lips, snoring or gurgling. A lot of individuals do have a loss of consciousness or that altered mental status. Their heart rate is going to be slow. Their skin is going to be cold and clammy. They're going to have pinpoint pupils, so their pupils are going to be very small. They might have some kind of uncontrollable muscle movements or muscle rigidity. So you might notice that they're not moving their arms very well, or their jaw is very tight, and then limp and unresponsive. So this is your typical opioid overdose here. For lots of us who have been working in overdose response, we know sometimes this isn't what an opioid overdose looks like. Sometimes they are kind of up and moving around, and you just kind of notice that bluing of the lips. And so we do see some dyskinetic overdoses overdoses as well. So it's really important to be looking at that respiratory rate. Like, are they breathing? What are their lips looking like? So right now that is getting a little bit difficult because a lot of clients are coming into organizations and everyone is masked. So making sure we're checking in on clients, we're looking at kind of, are they unresponsive? What's their skin looking like? What are their eyes looking like? That kind of thing, because looking at that mouth area might not be an option for individuals, depending on what setting you're in right now. So what are some things we're going to do if we're responding to an overdose? So one of the first things we're going to do is we're going to put on PPE. So I'm going to go through what that looks like, what PPE you should be using. I'm going to show a quick video after this. So I just took a clip from AHS's donning and doffing video. So I only took about 30 seconds of this video, but the full video is on ahs.com. It's just under donning and doffing of PPE. I mean, it's a really great video. It's about 15 minutes long. If you're wanting a more in-depth kind of audio-visual aid for PPE. I know I went over in-depth PPE last Tuesday, but I'm sure there are different people on this call. So we are going to go over it just briefly, and then we will move on to how to respond to an overdose. So the first thing you always want to do is give your hands a good wash. So that 20 seconds with soap and water, or using an alcohol-based hand sanitizer. The first thing you want to do is put on some kind of gown for an overdose response. So if you don't have access to a gown at your organization, it is not a bad idea to bring a spare set of clothing with you to work. So whether that's just like an extra sweater that you can put on if you're responding to an overdose, just so that you're making sure you're getting kind of that coverage in your forearms and your back, and you're protecting the clothing that you would be wearing to go see other clients, so you're not transmitting any kind of infection to other clients. So after that gown or extra piece of clothing is put on, you're going to put on your mask. So your mask always goes on first before your goggles and your gloves. So I'll quickly show there. Like I said, I'm going to show you a video, but I'll quickly go over it here. So when you're grabbing your mask, you're going to grab the outside, put it over top of your nose, loop it over one ear, loop it over the second ear, and then kind of bring it down below your chin, making sure there's a good enough seal above your nose, like so. And then your third step is going to put on your goggles. So your goggles look different depending on what organization you work for. Some staff bring their own goggles, but you want to just grab them by the sides, one kind of swift movement, put them on, and then put on your gloves after. So some organizations are using face shields. So the face shield, basically there's just kind of like a styrofoam piece at the front, and then a shield that goes down and covers just to the base of your neck. So that is in replacement to goggles. Those are typically one use only. So different organizations are using them for the whole shift, and that's okay. You just don't want to share them because you actually can't clean that styrofoam or padding aspect that comes in contact with your face. It's really hard to clean that. So you want to make sure that if you are using that, you're the only person that is using that until you throw it out. Goggles, there is single-use goggles, but most organizations are using the multiple-use goggles. Just make sure you're cleaning them properly at the end of your shift, which I can go over as well when we talk about taking off PPE. And then again, putting on your gloves. So I'm going to show you a quick video just from that AHS donning and doffing video. I haven't quite learned how to, bear with me here, I haven't quite learned how to get the sound with the videos on Zoom, so I can narrate it a bit, but that's why I did kind of the quick demonstration prior to showing you the video. So hopefully it makes sense with my narration. Okay. So again, the first thing we're going to start with is we're always going to begin with hand hygiene. So washing your hands, you're going to put on your gown, you're going to make sure your gown is tied at the neck and the base, or if you're using a sweater, and then putting on your mask and your eye protection, and then gloves, make sure you're putting those on at the end. And then mask and gloves, they can be worn as long as they aren't wet or damaged, but make sure you're changing them once they become wet or soiled as soon as possible, just so that you're getting that accurate protection. Okay, so overdose response during COVID-19. So again, we're going to put on that appropriate PPE. So this overdose response is if you are in your organization, EMS doesn't necessarily come on site, or if they do, they don't use oxygen or CPR, or if you are responding just independently without oxygen or CPR. So those aspects are really important, just because how you're going to respond is going to be a little bit different. So the first thing you're going to do is put on that appropriate PPE, which we went over. You're going to clear the room. So the reason you're going to clear the room is because if EMS does have to come, if they have to start oxygen or they have to do CPR, you want to make sure no one else is in that vicinity, because everyone else will need to be in a different type of PPE if they start using oxygen. So anyone who is not responding to the overdose, just get them to go into a different room, check on other clients, kind of mitigate the situation. The second thing, or the third thing you're going to do after you've cleaned the room is you're going to try to stimulate the individual. So whether that's just like a trap squeeze, a sternal rub, so that's kind of rubbing of their chest. Some people prefer to take like a pen and just stick it over the individual's nail bed and press down. So any kind of pain response that could get the individual to rouse, and then encourage them to take breaths, that kind of thing. So if there's absolutely no response or their breathing is limited, you're going to call 911. So again, calling 911, the time of it is going to depend on your organizational's policies. So if your organizational's policy is kind of the moment you suspect an overdose, you call 911, follow that policy, and just move kind of that calling of 911 to where it would fit appropriately. So you're going to call 911. If you are giving rescue breaths within your organization, make sure you're using the shield that is in the Narcan kit. You are still in very close contact with that individual, but it will provide you some protection for that. Then you're going to give Narcan, naloxone. If you have the IM injection, that is the preferred method right now, just because it doesn't have to come in contact with any kind of mucous membrane. You're going to assess for 2 to 3 minutes. So after you've, so we say 2 to 3 minutes right now in COVID-19, just because we aren't generally giving rescue breaths. So we're giving Narcan a little bit more freely, because we're not giving that supplemental oxygen necessarily. So Narcan does generally take 2 to 5 minutes for it to fully take that effect, but we're kind of using that 2 to 3 minutes right now, just as that safety precaution for our folks. So you're going to assess for 2 to 3 minutes. If there's no change or their breathing still isn't benefiting them, so we say like a good breath is like 12 breaths per minute. So if they're breathing like 12 breaths per minute, or if they wake up after the first dose, stay with them. EMS can still come in and do a check over them. But if their breathing is still absent or minimal, that rigidity is still present, they're limp, there's a loss of consciousness, or they're not responsive, give a second dose of Narcan. So you're going to continue that cycle of giving Narcan, kind of evaluating for 2 to 3 minutes, then giving Narcan until either the individual wakes up and they're responsive, they know where they are, that rigidity is gone, or EMS shows up and takes over. So if they do wake up and they're responsive, the best thing you can do is just to put them in the recovery position, if they're willing to do that. Some people are they get up and they're like, oh, we're good, I'm good, and they don't really want to lay down. So do your best to encourage them just to stay kind of in that area and let EMS do a proper assessment on them. So that's an overdose response with COVID-19. If EMS is not coming in and doing oxygen or providing CPR, we're going to talk a bit about what happens if EMS does show up and then does start doing those interventions with a client. But the only thing that has changed with it is our breaths. So we are generally not giving those rescue breaths. We're not providing oxygen right now, just because it increases the risk of COVID-19 becoming aerosolized. So once it becomes aerosolized, which we're going to talk about, those particles are now in the air. They're a little bit lighter. They last quite a bit longer in the air than they than they would, and then it increases the risk of other people becoming infected because that infection actually goes airborne. But that is the only reason why COVID-19 will go airborne, is with those aerosolizing procedures. So I know there has been a lot of talk about, oh, is COVID-19 an airborne infection? No, it's not. It's a droplet and contact precaution infection, unless we're using aerosolizing procedures. So that's high flow oxygen or CPR. Okay, so responding to an overdose with EMS present. So if you are in the vicinity when EMS comes and they are going to be giving oxygen, you have to be in PPE. And you have to be in appropriate PPE if they start using oxygen or doing CPR. So appropriate PPE, you're still in your gown, you've still got your goggles on, you still have your gloves on, but your mask is going to change. So instead of using a surgical mask or a cloth mask, if organizations are using that, it's going to be an N95 mask. So these masks have to be fitted prior to use, or else they're really not that effective. So they are fitted for each individual space. So that needs to happen if individuals are going to be staying in that room when high flow oxygen or CPR is present. So if your organization doesn't have N95s and you haven't been fitted for them, if EMS comes in and they are indicating that they are going to be either doing CPR or using high flow oxygen, just leave the room, just to protect yourself, to protect others. So again, clearing anyone extra out of the room just in case EMS needs to do oxygen or perform CPR. One of the things that I personally like to do when I'm meeting EMS is, if we can have or it doesn't even have to be healthcare staff, but a staff member meet EMS outside, just to give them a brief report of, okay, what's been going on, what happened, how many Narcans have we given, that type of thing. It's really beneficial for EMS, but it also can reduce a lot of anxiety for the client has overdose, but also other clients who might be seeing it, just because it can be a lot of stimuli when EMS first comes in for clients, and there's a lot of questions, and it can be very overwhelming for our folks. So if it is possible to have a staff member just meet outside, either just the area that individual is in, or just outside the organization, it really does benefit both parties involved. So again, if oxygen therapy or CPR is being performed, anyone in that area needs to be in that N95 mask. So those are the differences if EMS are going to be present. And these are just, we've been using kind of towardstheheart.com, just the overdose in the context of COVID-19. Alberta Health Services does have a community response for overdose, and it's excellent as well. They're very, very similar. I just haven't had a chance to update this presentation since that one came out. So if we're looking at taking off PPE, so that's whether or not you've responded with an N95 mask, or you've just kind of given Narcan with no oxygen present. How you take off your PPE is very, very important, so that you're not spreading any type of infection to others. So the first thing you want to do is take off your gloves. I know we've talked about this in detail. So you're going to take them off. You're going to give your hands a little scrub, so that 20 seconds, or with alcohol-based hand sanitizer. Then you're going to take off your gown, or if you've got an extra item of clothing on. So if it is like a sweater, it is going to be a little bit more difficult because it is going to touch your face a little bit. So if you do have something that just zips up, it's a lot easier to take off, and a lot more safer for yourself and others, just to have a zip up kind of hoodie or like a button up sweater, anything like that can kind of cover your clothing. Once that's off, again, you're going to wash your hands. So once you've taken off your like your gown or your sweater, you want to make sure you're sticking it into like a soiled bin or a bag and sealing it, just so that no one else can brush up against it or be in contact with it and kind of risk moving that potential infection throughout your organization. After you've washed your hands, you're going to take off your mask. So again, I can quickly put this mask on here to show you. So when you're taking off your mask, you want to take one loop out, and then I like to kind of let that momentum settle a little bit, and then take the other loop. I like to lean forward again, just so that you've got that downward momentum, and then just take it off and chuck it in the garbage. And then when you're taking off your goggles, again, I still like to use that downward movement. When you're taking off your goggles, you wanna touch like the sides or the back. So you never wanna take off your facial PPE by the front, just because then you're getting all those contaminants all over your hands again. So side, one swift movement, and then just drop them down, and then give them a good clean, and then always wash your hands once you've removed all PPE. So one thing that I do want to touch on with overdose response is just the cleaning aspect afterwards. So for cleaning after you've responded to an overdose, if oxygen hasn't been involved or CPR hasn't been involved and there's no risk of any of COVID-19 particles aerosolizing, you're going to change your gloves, or make sure you're just wearing gloves. Then you're going to clean your surfaces and equipment that you've been in contact with, or that individual has been in contact with. If you're using like an SpO2 monitor, or anything such as like it just sticks on your finger to monitor oxygen rates there. You're gonna wanna make sure you clean all of those surfaces with, if you're using like Cavi wipes or Excel wipes or a solution with 60% bleach, whatever your organization is using to properly clean and disinfect, make sure you're cleaning those surfaces. If the bottle that you're using is like a spray bottle, make sure you're spraying it into a cloth, because if you're just spraying it willy-nilly, it can actually, it's an aerosolizing procedure, so it can cause those particles to come up. So then after you're done cleaning all those surfaces, make sure you are changing your gloves. So the gloves that you did wear to clean, you're taking them off, you're chucking them in the garbage, and then you're putting on a fresh set of gloves so that you're not spreading any contaminants around your site or to any other folks. Now, cleaning up after an overdose, if EMS does come and provide oxygen and or CPR, it does look a little bit different. So the reason why it looks a little bit different is because the potential for aerosolizing aspects of COVID-19 is there. So again, you want to make sure that room is clear. And the reason you're wanting to make sure it's clear is just because there is now potential aerosolizing particles in that area. So it is actually best to clear out that room for about an hour, just to allow those particles to settle so that you can properly clean and not risk exposure to other people and other individuals. So again, that hour just allows for those particles to drop. They are quite heavy if they haven't been aerosolized, which is why we just need that 2 meter distance, as they kind of just fall to the ground there. You want to make sure you put on gloves then to clean after you've cleaned. If you still have on your mask, it is a good idea to keep your mask on while you're cleaning as well. I wouldn't put on a fresh mask, but if you still have your mask on, just keep it on. Clean the surfaces and equipment like you would normally. But then the really important aspect is you want to change your mask after. So if you do have that ability and the availability of masks, you want to make sure to change that mask after, using kind of the proper cleaning protocol for your goggles and your mask as well. So your mask, you're just going to check it out. If you're cleaning your goggles, how that's going to look is you always want to go from the dirtiest aspect to, or sorry, the cleanest aspect to the dirtiest aspect. So you're going to start on the inside here, clean the handles, and then move to the outside. If you can just use soap and water. If you are using like a Cavi wipe or an Excel wipe, that's fine too. But I would encourage you, if you are using a Cavi wipe or an Excel wipe, just to run them under water after, or else you'll get a lot of streaks, and it's really hard to see. And then just pat them dry with paper towel or whatever your organization has, just to what you'd use to normally dry off your hands there. Okay, and then last but not least, so overdose street response. So teaching for our clients. So one of the main thing, if really encouraging our clients to call 911. And there's a lot of reasons for that. Right now, and this is really important just for everyone to call 911 right now, because there is so much benzodiazepines in fentanyl right now. The risk for overdose is higher because it is also a sedative, but it affects a different area of the body. So it affects what we call a GABA receptor in the brain. And Narcan doesn't work on a benzodiazepine just because Narcan affects responds to what we call an MU receptor. So that's kind of your opioid receptor in your brain. So for individuals, if an individual is taking a lot of fentanyl and there's a lot of benzodiazepines in it, their rest rate could potentially drop a lot lower, but also they'll be harder to wake up. So you might notice that their loss of consciousness stays quite a bit longer, that sedation is really present. So it is really important to make sure you're calling 911, because the Narcan that you are going to give, it will work wonders on the fentanyl that is in that whatever substance that individual used, but it will not work on the benzodiazepine. So it is really important to call 911 so they can take the proper precautions and protocols that they are using to keep that individual safe. So it is really important to relay that to clients as well. Clients are very aware that there's a lot of benzos going around in fentanyl, but just encouraging them to call 911 and giving them that rationale as, you know, that Narcan isn't going to work on the benzo component of it. So to keep yourself safe, keep your friends safe, make sure you're calling 911. So you're gonna call 911. You wanna make sure you're putting on gloves that come in the Narcan kit, or if you have, if they just have gloves handy, but gloves do come in the Narcan kit, so make sure you're putting them on. Encourage them to try to stimulate the individual, whether that's a sternal rub or kind of a trap squeeze, same as what we would do in our organization, and then administer Narcan appropriately. So kind of in that outer thigh region. One thing I do like to really relate to clients though is that if they are giving rescue breaths, because a lot of clients on the street right now are still giving rescue breaths to their friends, to their family, it really encourages them to use that face shield that is in the Narcan kit. The face shield has a one-way valve. So it does protect that first responder from respiratory secretions. Get them to reassess after that 2 to 3 minutes. If they're still unresponsive with decreased breath sounds, give another dose. Repeat until EMS comes. Encourage that client who is responding to stay with that individual. And if they can't, encourage them to leave all the vials beside the individual so that EMS knows how much Narcan they have already gotten. One thing that I also like to mention to clients is a lot of them do like to do chest compressions. So if they are doing chest compressions, if they're like, no, I'm 100% still going to do them. If they have like a spare like t-shirt or some piece of cloth that they can just put over that individual's face lightly, just so that the secretions from that person doesn't spread during CPR, that kind of will reduce the risk a little bit. It's not the most sanitary, but it will decrease the risk of exposure to the person who is responding to that overdose. And then after they've responded, try to convince them to give their hands a good scrub with that. All right. So that's kind of overdose response in a nutshell. So I know I've showed these before, but Westside has made some infographics if any organizations are wanting them. So some of them just go over personal tips, how to keep everyone safe, screening, communication. And then we do have an FAQ for the shelter setting and drop-in setting that individuals can utilize as well. I'm happy to send them out. If anyone wants them, just shoot me a message on here, or you can email info@westsideharmreduction.com, and I will gladly send them out to anyone who wants them. So we'll get into our question answer segment. So if anyone has any questions, everyone is muted. So if you do want to just go into the question answer box at the top, or you can send a message via chat, either or, and we can just go through different questions that anyone might have about overdose response or any other question they could potentially have. So we'll give it a couple minutes here to see if some questions roll in. If not, if you just have a question that you just like answered like individually, or want to have a discussion about anything, you're always welcome to email info@westsideharmreduction.com, and we can set up a time we can have a phone chat as well if you're finding that easier. Yes, and for anyone who is wanting a recording of this webinar, I'm happy to send it out. We do record them to much of my demise, but we do record them so I can send them out to agencies as well. They are password protected, so I do send that password with it as well. But yes, I can send that out. So we will be having another webinar on Friday. So Friday's webinar is actually strictly a question answer webinar. So we did one of those 2 weeks ago with a really good response, and individuals were just wanting a straight question answer period. So that will be Friday at 10. So again, I can send out that link as well. And then next week on Tuesday, we're going to be going over screening. So COVID screening within your organization. Then next Friday, we will be going over just organizational setup. So how to set up your organization for success with COVID-19 and reduce the risk of transmission within your organization. Yeah, so AHS has their own documents for overdose response, but they actually created just recently, kind of in the last couple of weeks, an overdose response due to COVID-19. And it's just kind of a one-pager that goes through how you should be responding to an overdose in the community with the pandemic right now. So it is, to be honest, it's the same as what, or very, very similar to what I talked about. So make sure you're calling 911, giving Narcan, being in that full PPE, giving that 2 to 3 minutes to assess, and then giving another dose, and doing kind of that procedure until EMS arrives. Oh, thanks, Donna. Thanks for that. Thanks for that comment. I actually find the webinars quite awkward, so I'm glad you're enjoying them. Generally, we do all of our presentations in person. We just go into organizations and do lots within harm reduction and overdose response, and all of that good stuff. So this has definitely been a different platform for me. But if you're finding the webinars useful and just kind of easy to log on to with information, we can definitely continue them once COVID-19 is over. Yeah, so anyone who wants a copy of the webinar, just send me a message on here or at info@westsideharmreduction.com, and I'll just send it out as kind of a mass email. It does take about an hour for the webinar to be processed and put up on what we call our Zoom cloud. But then I will quickly edit my awkward 15 minutes before the webinar started, and then I'll send it out. Also, I have all of your email addresses as well. So when you sign up for the webinar, your email address is part of it. So you can even just say, yeah, I want one. I don't need your email address on here if you don't want to type it out. All right, well, that looks like it's it for kind of questions or comments. So we will sign off here, but anyone who is wanting to join just the question answer period on Friday, please join in. We generally have some pretty good discussion, just kind of brainstorming ideas and whatnot with different organizations. So it is a pretty good kind of half an hour, 45 minutes. And again, yes, I can share those one-pagers that were listed in here as well. Perfect, everyone. So we will talk to you later, and I will send out all of that information to those individuals wanting information from this webinar. Thanks so much. Talk soon.